Hey there guys, welcome back to the channel. So my name is Shivank and I'm currently a third year medical student at Imperial College London, and today's video is all about the ethics section of medical interviews. So in today's section I'll be going through different questions and my model answers to this and what structure I think you guys can use in order to best secure your interviews and really shine out to the examiner. So without further ado, let's get started. So, firstly, with ethics sections, I think ethics sections are one of the hardest sections because they can ask you a wide variety of topics. So, with standard questions, you can just ask why medicine, not nursing, and you can really easily prepare. Whereas with ethics section, they can throw you anything. They can throw you liver transplant, they can throw you Jehovah's Witnesses, HIV, so on and so forth. And so, it's really important that you have a good structure in order to be able to answer these questions. And so, a good structure, or at least a basic structure, is using the 4 pillars of medical ethics. So these are autonomy, beneficence, non-maleficence, and justice, and each are equally important when answering the questions. So a brief overview of every single one. Autonomy. Autonomy is respecting the patient's decision and the idea that the patient gets the final say. So with any treatment, whether it's a small treatment such as a minor surgery or something a major surgery, it's very important that you respect the patient's decision, and if they want the surgery, then it's up to them. If they don't, then they can refuse. Simple as that. Beneficence. Doing the most loving thing to do. A simple example could be if there's 5 people on one side and 1 person on another, and we had to pick which side survives, we'd pick 5 people because the most loving thing to do is to save the greater number of people in this case. Similar with non-maleficence. So non-maleficence is doing the lesser of the evil. So less of the evil in this case is 1 person would die or 5 people would die. So we'd rather 1 person die than 5 because the number is simply smaller, and so less grievance would be caused. And then finally, justice. Justice can be very ambiguous, and I feel like it's one of the hardest ones to define. So justice is doing what's equal and what's right. So by that, I mean, if there's 5 people and 1 person, but that 1 person is let's say, if doctor or physician who has saved millions or multiple lives, whereas the other 5 are convicted criminals, then doing the just thing could be saving the doctor, because the doctor could go on to save many more lives, whereas the criminals have committed crimes and then should be punished in comparison to the doctor who should be saved. And so you can see how by using the pillars of medical ethics, they not always will agree with each other, and there can be some arguments, and that's what the pillars are used for, help you create a really cohesive argument with pros and cons in order to come to an overall conclusion. Furthermore, with ethics questions, it's very important that with any question they have a specific age usually. So it could start off by saying a 70-year-old elderly lady, it could say a 14-year-old girl, so on and so forth. And so it's really important that you know the idea of consent. So consent or capacity is the idea of a patient being able to make a decision, and there's certain criteria that they have to be able to fulfill. So firstly, they have to be so let's say you're a doctor telling information to a patient. The patient, first of all, needs to be able to understand the information being told to them. So, for example, if it's a surgery, they understand, okay, I have a major surgery going on. Secondly, the patient needs to be able to process what's being said. Thirdly, the patient needs to be able to relay the information back to the doctor. And then fourthly, the idea that they needs to be able to come up with a plan as to what going forward. So this is really important. If someone isn't able to understand the information and relay the information back to the doctor, then that clearly shows a lack of capacity, and so in this case the patient will not be determined competent for the surgery or for any other medical procedure in this case. And so it's really important that they understand the information being presented, they're able to relay it and have a discussion with the doctor, so on and so forth. There's also many different buzzwords which are very important to learn within medicine, and I'll mention a few here, but obviously the more you read and the more questions you do, the more you come across it. So for example, Jehovah's Witnesses. So Jehovah's Witnesses are a denomination that believe in refusing or not partaking in other people's blood transfusions. So a typical question that they could ask is, a patient comes in requiring a major blood transfusion for a because of the surgery gone wrong. However, the patient is a Jehovah's Witness. What would you do? You'd first of all assess if the patient has capacity, because if they don't have a capacity to make a decision and there's no family members immediately, then it's up to the doctor to make the best possible decision. But let's say if they do and they refuse blood transfusion because it goes against their religion, then we would have to accept their decision. Ultimately, as a doctor, what we can do is advise the patient and say it's in our best interest to try and maximize and save your life. But obviously we have to respect the patient decision because of the pillar of autonomy. So this is how hopefully you guys are understanding how you can use the 4 pillars of medical ethics embedding in your answer, rather than to just bluntly saying, okay, now let's talk about autonomy. You can just certainly mention it in, which is really key. Moreover, linking back to capacity and consent, so there's something called Fraser's competence, and this is to do with the idea of a 16-year-old, so whether determined competent or not. So if they're able to do, as I mentioned, process the information and read the information back to me, then that's really important. And it usually applies specifically to contraception and sexual health when talking to a young person of 16 years of age. And so it's really important that if they ask you a question about Fraser's competence, that you're able to understand this. And finally, a question which gets asked multiple times and many students just completely freeze on the spot, and so I'm giving this advice for you guys so that you hopefully don't, is the 6 NHS constitution values. And these are really important to note because they could simply ask you, okay, list one of the NHS constitution values and demonstrate where you have shown this. So the 6 NHS constitution values are compassion, working together for patients, commitment to quality of care, respect and dignity, improving lives, everyone counts. If I missed one, I'll include it right now, but I believe those are the top 6 for the NHS constitution values, and so it's really important that you know this off by heart. This is because they can ask you a lot of questions about this, so they could ask where you demonstrated this. So compassion, in my work experience when volunteering at a care home, I demonstrated compassion by looking after the elderly patients and talking to them about their day-to-day life and really understanding understanding where they're coming from and just cracking jokes with them. That's showing compassion, and really because you're not only listening to them, you're showing that you're appreciating them, making them laugh, making them feel comforting, feel satisfied in their environment, which is really key. So now let's tackle some model questions that you guys could be expected to ask. And this is simply taken online, so I've just searched up online ethical questions. If you have the choice of giving a liver transplant to a successful elderly member of the community and a 20-year-old drug addict, who do you allocate the organ to, and what factors would influence your decision? So there's 2 possible options. I can either give it to an elderly member of the community who has been successful, or the 20-year-old drug addict. And so immediately I think, okay, let's talk about my checklist. So consent. In this case, consent and capacity already is assumed in this case, so you can move on to the next step. So let's talk about 4 pillars of medical ethics: autonomy, beneficence, non-maleficence, and justice. So with autonomy, both patients will obviously want the liver, so it's not as applicable in this case. Now let's talk about beneficence. And in this case, beneficence and non-maleficence really intertwine because we're doing the most loving thing. Because by doing the most loving thing, we're also doing the less of the evil in this case. So, with the elderly member of the community, she has clearly been a successful person within the community, and so there's a chance that many people in the community would look up to her, and the idea that the community could be thriving because of her good deeds. And so by depriving the community of this member would be a big like red flag, and would potentially cause the community to collapse. And so in this case, a lot of people are relying on this one elderly member. Whereas with a 20-year-old drug addict, the idea that since the patient is a drug addict, and many of the drug addict characteristics are people who are on their own, and especially because he is young, there's a less chance that he has built up the same social connection that the elderly member has, and it also assumed because the elderly member is successful. So in this case, doing the most loving thing to do would be giving it to the elderly member of the community, because that is, there are many more people who are around her who would be influenced by her compared to the 20-year-old drug addict. That also links with non-maleficence. Now let's talk about justice. So justice is doing what's right in this case. So in this case, we have the elderly member who's done good deeds and is doing good for the community compared to a 20-year-old drug addict. Now, depending upon which point you choose, each one can be justified. So let's talk about my point, the idea that I am in favor of the elderly member of the community. And so because she's done great deeds, the idea that it's justified to give her the liver transplant because I'm sure that she'll put it to good use. Whereas with the drug addict, there's a higher chance that they're taking different substances, drugs, alcohol, etc. And so there's a high chance that the liver, there might be a relapse, and the idea they're not taking good care of. And so in this case, I would give it to the elderly member. However, if I was arguing for the different side, the idea that with a 20-year-old drug addict, he has not lived as long as the elderly member, and so it's unfair or unjust not to give it to the drug addict because he's got a lot more life to live. And as doctors, as medical professionals, we can educate the patient about the importance of not taking drugs or not taking alcohol, etc. The idea we don't want the liver to be damaged, in this case, in order to maximize his longevity and maximize his health. Whereas with the elderly member of the community, unfortunately, they don't have as much longer to live. And so by doing the most just thing would be going to the drug addict, because he has the liver will be used for a much longer period. So you can see how, depending upon your answer, you can really construct a good answer just using the 4 pillars as a good structure. And so let me do one more question. So this is a different type of question which you can experience, but something that could be asked in medical interviews. So, what is your opinion on a patient giving their doctor gifts for work performed? Now, this is quite a difficult question, because obviously you can't use the 4 pillars of medical ethics. It's not really as applicable. So you have to know when it's applicable. If it's like an ethical question such as Jehovah's Witnesses, the idea when it usually involves patients, then that's applicable. Whereas in this, it's just simply talking about gifts and about an object. So with gifts, it's a very fine line. The idea that with small gifts such as chocolates or simply a card saying thank you, I think it's fine to accept, as long as it doesn't create any form of bias. If, for example, you say no to the chocolates or to the card and this creates a negative impact on the patient, this would have a much more negative influence than simply accepting the gift and perhaps distributing with your colleagues. So it's really important that you understand, that you explain to the patient saying, I understand, thank you for your gift, but as a medical profession, we're not really supposed to accept it. If they insist on accepting, then a small gift such as chocolates can be accepted, and you can explain how you're going to distribute it with the rest of the colleagues, which is perfectly fine. Whereas with major gifts, whether it's buying, I don't know, a car or a TV or something really expensive, then this would create a form of bias, first of all. That the doctor could perhaps be biased towards the patients because of the gift that's provided, and also could influence the treatment. And so it's really important in that case that you're insistent to the patient, saying like you're grateful for showing his gratitude or that her gratitude for the gift, but that you need to, but that you can't accept it because of the policies in place. And so overall, in this case, as a doctor, I would accept very small gifts because it will influence my line of work, and the idea that the patient's care, a patient will also feel grateful that they've given a gift to me, and wouldn't conflict the patient-doctor relationship, so key term patient-doctor relationship. And in the case where they give large presents, I would have to refuse and simply show my gratefulness by repeatedly saying that thank you for the gift, but I cannot accept such major gifts. So this is quite a difficult question, but you can see how I've tackled it, and again provided 2 points. That's the main thing you want from this. You want to provide 2 different points, 1 pro and 1 con at least, and then talk about the different points. And finally, the main takeaway that I want you to learn from this is the 4 pillars, obviously with medical ethics, but also use of key terms. So the idea, as I mentioned before, patient-doctor relationship is a key one. A lot of ethical questions, they will involve taking the overview of the patient, or a better word for that is holistic care. So make sure you mention that your question saying, when taking care of the patient, I will look at the patient in a holistic manner, not just the physical conditions which they have come in. And that's something as simple as that will show the examiner, okay, he's been reading upon the different medical terminologies and is clearly well versed in this. So hopefully this video was helpful for you guys. If you have any questions, please feel free to message me, and thank you guys for watching.